So good afternoon, everyone. Okay, so today, last few lectures, we covered the Strongyles of ruminants, and in the last lecture, just the last parasite we covered is Ossophagostomy, if you remember that one. That is a Strongyles of ruminant. We covered. So as I said, that we will be start equine strongyle in this lecture. So you don't need to be memorize all these taxonomy. The most important point here is today we will be covered large and small Strongyles. So the learning outcomes, you will get the knowledge of the life cycle diagnosis or pathogenesis of the small and large Strongyles, where we covered the Strongyles species as well as Cyostomum species. So you will get the understanding of the clinical sign and how to diagnose these small and large Strongyles. Analyze the drugs that have a high prevalence of resistance in these two group of parasites, and also the evaluate the treatment of choice for the larval stage of the Cyostomum. Okay, so equine Strongyles, general characteristics, most important parasite of adult horses. The adult parasite normally reside or the predilection site is the alimentary canal tract, like large intestine, cecum, column, and the buccal cavity, the mouth part of this parasite, used as a primary mean of identification as shown here. So this is the mouth part, and this is the teeth of this parasite. So, and this is the interior part of this group of parasite. So, as I said, we will be covered equine Strongyle, that these are the last equine Strongyles, that is the large Strongyles, and equine Cyostomum, small Strongyles. So, large Strongyles, the most important parasite of horse and donkeys. The most important species are Strongyles vulgaris, highly pathogenic. The other two important species are Strongyles edentatus or Strongyles equine. So you will see the mouth part of these three group of parasites. They are pretty different based on their teeth and the buccal cavity. These parasites normally reside into the cecum and column, large intestine. They have a long pre-patent period. It will take like 6 to 7 months or 8 months to complete their infection. So the eggs are always oval shape, and again you can't able to differentiate, same like Trichostrongyle eggs, the same here, Strongyles egg, like you can't be differentiate the Strongyles as well as Cyostomum eggs. They are very similar in shape. So, for in the case of the male and female adult worms, they have a well-developed capsule, buccal capsule in the interior end, that is shown here. And on the other hand, you will see the specules and bursa that are dominated in the adult male in the posterior end. In the female, you will not see the specule and bursa. You will see the female sex organs on the posterior part. That is, you will see the vulva or vagina or the eggs in the uterus. So that is different between male and female from the posterior end. So as I said, these parasites are normally reside into the alimentary canal, and especially in the cecum and column. These worms are large, stout shape. They are brown, dark red in color, as shown here You can see very red blood worms, so you will suck the blood. So the larvae penetrate into the out of the GI tract and undergo to the migration toward the mesenteric canal or other part of the body. So this parasite has a migratory behavior. So the larvae is responsible for the majority of the pathology in this group of parasite, and this parasite has a worldwide distribution. Previously, there is a very high prevalence has been seen in this group of parasite, but now due to the better farm management, the prevalence is pretty low, and this parasite is not a very much important parasite as far as the prevalence is concerned. So let's start with Strongyles vulgaris. As I said, is a highly pathogenic parasite of horses. It is normally seen in the adult horses. Now is uncommon and is not very much important for the disease point of view, because of the better farm management is one of the reason. Better deworming program is one of the reason, and we'll talk about the deworming strategy for this group of parasite in the previous years. That's why the prevalence and the control strategies are better in this group of parasite, and resistance is not the issue in this case. For the life cycle, that's really important. Let's start with the life cycle of Strongyles vulgaris. Pre-patent period is pretty long, is 6 to 7 months, and the L3 stage larvae, they can penetrate into the cecum and column mucosa, where they converted into L4 stage larvae. So this L4 stage larvae then migrate into the cranial mesenteric artery. So this parasite has a migratory behavior. So L4 stage larvae migrate into the cranial mesenteric arteries, and about 14 days post infection, it will be there and remain there for at least 3 months, where it converted into or molted into L5 stage larvae. So this L5 stage larvae further again come back into the large intestine and then penetrate into the serosa or make a cyst formation within the large intestine and form a small nodule formation, and then emerge into the lumen to become adult. So this is how the life cycle of this Strongyles vulgaris will be. So the important point is this parasite has a migratory behavior, and it migrate into the cranial mesenteric artery. In the case of Strongyles edentatus, the life cycle is little bit different as compared to Strongyles vulgaris. Pre-patent period is pretty high, 11 to 12 months. On the other hand, L3 stage larvae, they penetrate into the intestinal mucosa, converted into L4 stage larvae, and this L4 stage larvae is then enter into the portal circulation and then reach into the liver. So you can see the difference here. Both have migratory behavior. However, in the case of Strongyles vulgaris, they migrate into the cranial mesenteric arteries. In this case, it migrates into the portal vein toward liver. And then L4 stage larvae migrate into the subperitoneal fat onward of the abdominal wall, and where it converted into L5 stage larvae. So L5 is a juvenile stage. They will be stay there for a while, and then the L5 stage larvae migrate back into the intestine as like cecum and column, where they cause this hemomalasemia illi. So this is what it look like. The intestine will be look like. It's approximately 5 centimeter wide, 5 centimeter to 7 centimeter wide. These fresh, bright red color lesions or sometimes yellow brown color lesions you will be seen. So this is called hemomalasemia Li. So that is the feature of this group of parasite. So now you differentiate between the Strongyles vulgaris life cycle with the Strongyles edentatus life cycle. Okay, so I hope you understand the life cycle of this group of parasites. So if anyone can able to explain the life cycle, I make a very beautiful picture of this. The life cycle is a handmade sketch. So can anyone able to explain the life cycle of this group of parasite? From where we can start? For example, so migratory behavior in any of these species, the male and female, they lay egg, female lay egg pass out along with the feces in the environment, in the grass, where it converted into L1 stage larvae. This L1 stage larvae come out from the eggshell and converted into L2 stage larvae in the feces. From feces is converted into L3 stage larvae, and this L3 stage larvae is the infective stage. So again, similar to the Strongyles, L3 stage larvae is the infective stage, and then is penetrate into the intestinal mucosa, and then mold are converted into L4 stage larvae. So what is going to happen for the L4 stage larvae in the case of Strongyles vulgaris? L4 stage larvae migrate into the cranial mesenteric artery. So from cranial mesenteric artery, which stage it will convert it into? L5, and then migrate back into the intestine. In L4 stage larvae in the case of Strongyles edentatus, where it goes to? Liver, portal vein, liver, abdominal wall, and then L5 stage larvae come back into the intestine, and where it causes a severe intestinal lesions. Okay, so as far as the pathology of this group of parasite is concerned, in the case of Strongyles vulgaris, L3 stage larvae in the intestine are highly pathogenic stage. How? It causes thromboembolism. If you can look it into this sphere sign of alteration in the intestinal mucosa, thromboembolism, that will further lead to intestinal infarction, and that will further cause the inflammation or necrosis of the intestine. Is a very, very severe lesion you will be see in the case of the L3 stage larvae. Yes.
Would the predilection site be the cecum and the colon, or would it be the large intestine?
Is overall in large intestine, but mostly they will be seen in the cecum and colon.
Thank you.
Okay, so L3 stage larvae causes very severe lesions in the intestine. First, once they invade into the intestine after the ingestion of the L3 stage larvae by the horse, then L4 stage larvae, it converted into L4 stage larvae in the intestine, where it migrate into because this parasite has a migratory behavior, it migrate into the cranial mesenteric artery, and is also pathogenic there too. So you can see they penetrate there and cause the thickening or inflammation of the cranial mesenteric artery. You will also see the arterial wall become thickened as shown here. And then you will see the thrombus formation, infarctions, and reduce in the blood flow. So it means that the larval stage, either the L3 stage larvae in the intestine or L4 stage larvae in the cranial mesenteric arteries, are highly pathogenic. Right? So here you can see the clinical lesions in the cranial mesenteric arteries, and you can see the worms are moving around here, and the thrombosis with the larvae in the cranial mesenteric arteries. So these are the lesions you will be see in the case of L3 and L4 stage larvae infection for the Strongyles vulgaris. Okay, so what gonna happen in the case of adult worm? Because remember the life cycle, once the L5 stage larvae, the L4 converted into L5 stage larvae in the mesenteric artery in the case of Strongyles vulgaris, but in the case of Edentatus it is in liver, they will convert it into L5 stage larvae and go back into the intestine. Right? So, and then in the intestine, L5 stage larvae is the juvenile stage. They'll further convert it into adult. So, adult, what is the pathology of the of adult in this case? Again, adult is pathogenic, but not as pathogenic as compared to larvae. The adult will start taking the blood or the tissue from the host intestine. So just think about the buccal cavity I showed you, the teeth I showed you in the initial slides. So these teeth will play a role to suck the blood or tissue from the intestine. The adult worm normally, that is these adult worm will play a role for make a plugs of the mucosal tissues with their buccal cavity. They form ulcerative lesions in the intestine. The pathogenesis is not very much similar to larvae. Larvae is a highly pathogenic stage, but they cause disease, these clinical disease by these adults will cause these clinical disease, but is not very common, but it will affect the well-being of the horse. So what it look like? So adult, as I said, they have a buccal cavity. They pick up they use that one to take the tissues as well as cause like hemorrhages and ulcers. And you can see here they can ulcers. You will see the ulcerative formation in the intestine. So this is how it play a role. Adult parasite play a role in the pathology of the in the intestine. So it means L3 stage larvae is pathogenic, cause thromboembolism or infarction in the intestine. Once they migrate it into L4 into the mesenteric artery, let's say in the case of Strongyles vulgaris, they will be also cause severe thickening of the arterial walls. And once they go back into the intestine and convert it into adult, they will also cause a severe disease, ulcerative hemorrhages and ulcer, but not severe as compared to larvae. So this is how the pathology of this group of parasites look like. Okay, so based on this one, what will be the clinical features will be. So as I said, this is not a very severe disease or common disease nowadays due to the better farm management. So if you will see the clinical sign, you will see the first sign will be the colic. That will be really important, right? So colic is one of the important signs will be seen, followed by some weight loss. Horses will become depressive, fever. So these are the secondary signs you will be see, but the most important sign will be colic. So most infected horses like with few worms, if the worms number are low, you will not see any clinical sign. So the severity of this disease is highly depend on the parasite load, how much parasites has been there. So young horses, yearling animals, they are more susceptible. Some degree of acquired immunity they have, and some most frequently seen in the yearling horses. Okay, so based on this one, what will be the diagnostics? So how we can diagnose this disease? Clinical sign or history, that is really important. But you will be perform the fecal egg count in this case. So you will perform the fecal egg count in this coming lab, the practical lab. And however, it is similar to Strongyles. You will not differentiate the small and large Strongyles. So it's difficult to differentiate based on the egg morphology. So fecal culture, that is one other alternate. So it depends. Anyone know fecal culture? What does that mean? How to culture this fecal culture? Alam, fecal culture. Just quickly. In the case of ruminants. In the lab. Yes. So you can grow convert the eggs into the larvae in vitro, not in the nature. Like you just give the feces some particular temperature, and then they can automatically convert it into eggs to L1 or L2 or L3 stage larvae. So this is called the fecal culture. So this is the larvae will be look like in that case. So that is somehow differentiable between Cyostomum and the Strongyles. So we could talk about Cyostomum later on, but these two small and large Strongyles are a little bit difficult to differentiate. However, PCR, one of the best method. I will show you what we have developed to differentiate, especially Cyostomum, not the Strongyles at this stage, but in the next part of my lecture, I will be show you the new technologies we developed to differentiate these group of parasites. So, in the case of if you look it into the necropsy, like in the intestine or is in the mesenteric artery. So finally, you will be look it into the buccal cavity at the interior part of this group of parasite, and buccal cavity. What the important role they will be play? What they cause? So teeth. Remember the teeth. So they just take the tissues of the intestine and cause hemorrhages of the intestine. So that's the main role they will be they will play. So here the typical lesions seen in these larvae, once the larvae infect the cranial mesenteric artery in the case of Strongyles vulgaris, or the larvae in the large intestine, either the L3 stage larvae before they go into the mesenteric arteries, or the L5 stage larvae, they normally come back into the intestine. Okay, so for the treatment plan of this group of parasite, luckily we are in a good shape here. Resistance is not the problem, not a big problem in this group of parasite. Ivermectin or moxidectin, this is the drug of choice that does perfectly well to treat this group of parasite. So ivermectin is a major drug to treat this Strongyles vulgaris. Fenbendazole is also effective, and that is the first drug introduced in 1960s to be treat this Strongyles vulgaris group of parasite, and that drugs work perfectly in this group at that time, and now ivermectin is one of the other alternatives. So that's why the management is very, very good, and the prevalence of this group of parasite is very low. So no drug resistance has been reported in this group of parasite. Okay, so let me check your knowledge now, if you have your point solution ready. Okay, so which of the following is the major site of pathology for Strongyles vulgaris? L4 stage larvae. Okay, so cranial mesenteric artery. So L4 stage larvae, they migrate into the cranial mesenteric artery, and then they cause a very severe disease, and the pathology is very, very is so important there in the cranial mesenteric artery. Okay, so let's start with the equine cyostomum. We call them a small Strongyles, and this parasite has Strongyles has a 3 most important species, but this parasite is a really messy, have a lot of species, like maybe more than 50 species, and the problem is they are very, very similar, and we can't able to differentiate the species easily. So there's a number of different genus, Cyostomum, Chronocyclus, Cyclocycla is a number of different species. You don't need to remember that one, you can't be. So the important thing what we have done in this group of parasite, we developed this horse nanobiome technology. So this technology, we can able to tell you, if you give us a fecal sample of horse, we can able to tell you that this is the species, most prevalent species of Cyostomum in your form. So that's the beauty of this technology. Other than that, like if you go with the fecal egg count, you will see the eggs, you never differentiate these species. Either you can't differentiate Strongyles with Cyostomum in that case. So and in the case of the larvae culture, it's difficult to differentiate these species. So this is the new technology we developed, and we applied into the field situation. It worked there. We developed it, applied. Now we are really further interested to take it into the diagnostic tool in the application of this technology in the horse industry. Okay, so Strongyles is not a primary parasite now, but Cyostomum, though it's not pathogenic, but is a primary parasite for the control program. On the other hand, Strongyles vulgaris, Strongyles is not a primary parasite because there is not a big problem of Strongyles anymore. But this one, less pathogenic but more prevalent. And there is a variable level of acquired immunity in the adult horses. As I said, this parasite is normally seen in the adult horses, either case of Strongyles or either Cyostomum. Horse, because they develop much better immunity, so up to like 50% with the very low egg in the feces. But those who has a poor immunity, the fecal egg count will be high. So it depends on the immunity of the horse. So this parasite also reside in cecum and column, oval shape egg, and is much bigger. If you see this type of a picture in the lions, you will be easily identify in the lions that this is a dark red in color and is 2.5 to 3 centimeter long adult worm. Pre-patent period is 2 to 3 months, but it also develops some hypobiotic arrest. So this parasite also have a ability to go into the hypobiotic situation based on the climatic conditions. Okay, so how this hypobiotic arrest will work? In the case of cold climatic transmission, if it is in the cold climatic region, the larvae, they enter into the arrest stage in the winter because it's the cold weather, and then they can come back into our developmental stage at the springtime, and you will see the spring rise of the fecal egg count. However, in the case of the warm climate transmission, the arrest or development will be happen in the summertime, and then they come back into the change their stage normally in the winter time, because in the warm weather, the winter time is not so cold like a cold climate conditions. But on the other hand, in the cold climatic transmission, normally you will see these parasite to be convert their arrest state in the springtime. So that's the difference between where this parasite is in the cold climate is different, or in the hot climate is different, the development, the arrest state. So this is how the epidemiology of this group of parasite will be worked in the case of cold and warm climatic transmission. Okay, so now Strongyles, migratory behavior. We talked about that. In this case, there is no migratory behavior. This parasite is not migrate from large intestine or cecum or column to any other part of the body. L3 penetrate into the intestinal mucosa, and in the cecum or large column, they make a cyst formation there. And then it converted into L4 stage larvae within the cyst. They make the cyst, L3 stage larvae make the cyst in the intestine, and then it converted into L4 stage larvae. And that is the time, you remember we talked about that arrest state is the L4 is the stage where parasite goes into the arrest state. And this is the time where it goes into the arrest state within the cyst there, right? And then once it the temperature is favorable outside, they can further convert it into L5 stage larvae, and then adult emerge there. So this is how the general life cycle or life cycle of Cyostomum will be. No migratory behavior, and the pre-patent period is less than Strongyles, that is 2 to 3 months, and depends on the species. But because there is a lot of species there, we can't able to say which species has which what is the pre-patent period of each species at all. So it's a genus level, approximately 2 to 3 months. Okay, so who gonna explain me the life cycle in this sketch? No migratory behavior, we know that. So what is going to happen first? Just start from here. Anyone can start from here.
So I guess the eggs get shed from the colon into the environment.
Yes.
They develop into L1.
Yes.
And then L2 in the feces, and then they get ingested in L3.
Yes.
Once it gets to L3, it goes into the intestines and develop into L4.
So you miss one thing here. I just spot it in the red.
L3 goes into the wall of the
Make a cyst formation first. Here you can see the cyst formation, and then convert it into. But this is the place where they go into the arrest state, if it can, and L4, and then finally L4 emergent into adult and start laying eggs. So this is how the life cycle of this group of parasite. Direct life cycle, no migratory behavior. Okay, so pathogenesis. So larvae are responsible for most of the pathology. In the case of Strongyles, yes, larvae L3, L4 is highly pathogenic, but somehow adults are pathogenic and cause ulcerative lesions. Here, larvae are highly pathogenic, and the L4 stage larvae, they make a cyst formation and cause the intestinal damage. And this is also one of the predisposed factor of the colic once they damage the intestinal mucosa, and they also produce the alteration in the GI motility, some ulcers, and where the larvae emerge from the cyst. In the case of adult worm, there is no observable lesions will be seen in this case, but we see the lesions in the case of Strongyles, some ulcers in the intestine, and they are not proven to be cause a very strong pathology as far as the adult is concerned. So the larvae cause a very severe damage of the intestine and make a very big cyst within the mucosa of the intestine, and that is one of the predisposing factor of causing colic. So this is how the cyst formation will be look like in the intestine. So this is one of the other example. You can see the cyst formation here, right? So based on this pathology, the most important clinical features will be, the sign will be heavy infection in 2 to 3 years old horses. You will see the high larval burden, and that will be cause hemorrhagic enteritis, and other signs will also seen like anemia and anorexia. You will see the profuse diarrhea and protein loss. So these are the most important signs you will be see in this disease. So as far as diagnosis is concerned, we already discussed that fecal account is the preferable method, is informative, but is not very much useful for the diagnosis of this disease. Why? Because what happens sometime, the host may have a low fecal account but a high disease burden. But on the other hand, sometimes the horse has a high fecal account but low disease burden. So it's vice versa. So that's why you will see the eggs in the feces, but you will not be able to differentiate based on the egg fecal account that what is the disease situation in the case of cystinosis. Other than that, you will be able to see that's why it is not very much straightforward, and also you can't able to differentiate with the Strongyles egg with the cystosoma egg. So it is difficult to say that we are dealing with the cystosoma, so we can treat it based on that, or we are dealing with the Strongyles, because we know the treatment plan is very clear and there is no resistance. But it's difficult to say which eggs you are dealing. So that's why we developed this technology, that you can easily differentiate these at least at the genus level. If you don't go into the species level, you can make a treatment plan that you are dealing with Strongyles or you are dealing with cystosoma. So also you will be able to see the history and clinical sign. That is one of the other options. Okay, so we talked about insisted larval cystosmosis. So that's in this case, you will see the encyst formation in the intestine. There is one other condition that is different from encyst formation is larval cyostomosis. So this is little bit different as compared to encysted larval cyostomosis. So this is a life-threatening problem, and you will be see the millions of the larvae in the feces. That is the unknown reason why this larval cyostomosis has been happen, but it causes a very strong poor protein loss enteropathy. They will damage the mucosa because there's millions of the larvae will be emerge in the intestine. The reason is unknown, but the condition is also very rare, is not seen all the time. So what you can see, so this is the clinical features in that case, is more severe as compared to encysted larval cyostomosis. So this one is cause a very, very severe disease in the horses, and the horse become emaciated within a days. So what you can see in the feces, so this is a little bit bigger. So see these red colors. So these are the larvae come out along with the feces. So let me zoom this one out. So see some more larvae you will be see in the feces. Let me zoom a little bit more out. So here you can see the larvae will be. You will not see this condition in the case of encysted larval cyostoma. You will not see the larvae there. You will see you will perform the fecal account in that case. But in this case, in the feces, when you see the larvae, it means is a larval cyostomosis. You are dealing with the larval cyostomosis. So you will see the cecal edema due to the larvae in the intestine. And also, for the diagnostic point of view, do you need the fecal account in this case? No, you don't need it, because you will see the larvae in the feces. So very clear. This is how you can easily diagnose. So you will see the large number of larvae on the feces. So this disease condition, you will not need to do the fecal account at all. For the treatment plan, either encysted larval cyostomosis or the larval cyostomosis, resistance is one of the biggest problem in this group of parasite as compared to Strongyles. Strongyles resistance is not the problem at all. That's why management is better there. But resistance is the problem here. So fenbendazole, widespread resistance. Fenbendazole, if you remember my lecture, is the benzimidazole group. Parental, also resistance. Microcyclactone, ivermectin, and moxidectin, they also reduce the efficacy. So it means that multi-drug resistance we are moving toward the multi-drug resistance in the horses. So what you suggest your horse owner? Just remember what we talked about in the Strongyles. You treat the animal. You just treat the animal and go home? No. In the case of ruminant, no. What will be your plan based on this one in the horses then? You treat the horses and go home? What you going to do then? What you going to do? Think about the multi-drug resistance in the case of Strongyles. Think about it. What you did there? Fecal account, post fecal account. Do the same practice here too, because multi-drug resistance is the issue here in the case of cyostomum. So exact same practice you have to be adapt here too. Encysted larval cyostomosis, moxidectin. Treatment of choice, it works. Drug resistance of fenbendazole is extremely common now, and but in the case of moxidectin and ivermectin, the efficacy is reducing. Larval cyostomosis, the prognosis is not very much good, but you need to start treatment in the early stages. So here is some of the resistance in cyostomosis. This one of the table I would like to show you, where you can see this fenbendazole is 100% resistant. Albendazole, that is also benzimidazole group, is 77% resistance. Parental is 55% resistance. Ivermectin is still susceptible, and they are reducing their efficacy, because normally what happens once you see the resistance here, the farmers start, or the veterinarians start using this drug. So this drug is start reducing their efficacy, right? So what will be your choice if you're gonna go with the treatment plan in the horses, based on the treatment plan of remember the treatment plan of in the case of Strongyles, what you gonna do? Combination, exactly. So combination is the best you can offer to your client, right? Okay, so some knowledge check. Oh yes.
So is this resistance only for the
Cyostomum, yes.
so not for the large?
No. That's why we want to differentiate them, and you can't differentiate with the fecal egg count. So if you can't able to differentiate with the fecal egg count, how you will be know that I have to be treat this? You are treating with cyostomum, or you are treating with Strongyles. So that's why PCR is the best method to differentiate first. Then you can make your plans, right? Because that is not the resistant at all. Right. Yes.
Before we're saying that we want to do the fecal egg count reduction test to make sure that they're not resistant. But I remember that they don't have high fecal egg counts. So would we be counting the larvae, or are we counting eggs?
Yes, that is also the problem. In sometime in the case of cyostomum, the biology is very variable. You are right. I mean, it's very variable. High burden, low count. Low burden, high count, high disease. So it's a vice versa. So that is difficult to say just on the base of the fecal egg count. That's why we want to develop some high throughput methods to tell the farmers that this is your drug of choice. That makes sense?
Yeah, that makes a lot of sense.
Yeah. Okay, so anyone has any question in their mind? Okay, so let's start with some knowledge check question then. So which of the following is the most pathogenic nematode parasite of adult horses reside in the cecum and column? Okay, so here we talked about highly pathogenic. Remember, Strongyles is the highly pathogenic. Okay, so let's put this way. Which of the following is the most prevalent nematode parasite of adult horses reside in cecum and column?